The Everyone with Diabetes Counts program, funded by the Centers for Medicare and Medicaid Services, offers no-cost diabetes self-management education classes for people with prediabetes and diabetes. Learn from a class graduate and a practice manager about their experiences with this program.
Good morning, this is Pat, and I'm here with Tony, who participated in the Diabetes Self-Management Education course we offered here in Lawrence just about a year ago, and Sue Fili, the practice manager, who is engaging her Medicare and dual eligible patients with diabetes or prediabetes to attend class.
Well, I learned through it through Sue and Dr. Yule. And the reason is just that I'm looking for classes like this to attend. So when classes do come up, Sue and Dr. Yule will tell me and give me the information how to attend the classes. I have diabetes, and it's very important to me to get educated on it. And that's why I attended the classes. Education. I learned how to eat. I learned how to read the labels. The class was excellent for me. It's very important, like yourself. You came across, you were very understanding. When we were going too fast, you slowed us down. When we were going too slow, you speed us up. So that, the instructors were very important to the class. It's made a big impact because at one point my sugar was out of control, my diabetes was out of control, and I felt that after the class I could maintain it. Well, one of them is when I made a meal, like a breakfast, and what would happen is I would just make my regular breakfast, and then we put it on the board, and it showed how much I was over, with the carbs and the fats and everything, the calories, everything. Then, through the class, I learned how to make a meal. And I had the book, there was a book given to us, so we knew exactly what meal to make and how to keep it within its range. And it worked perfect. Well, when you hear other people talk, and there was one gentleman that he had his own physical issues, and he came to the class, to get educated on diabetes, to educate his son who was dealing with diabetes.
Well, the value is that patients learn and they're engaged and they're educated, and it puts some ownership on them for controlling their diabetes, because we can sit and dictate, do this, do that, take your medicine, eat this, your A1C level needs to be that. But if you don't help them learn how to manage their disease, they go home and they don't know what to do. So this class, I saw people that thought they knew a lot about diabetes who came to me afterwards and said, wow, I didn't really know anything. And now I know what a carbohydrate is, and now I know how many carbs I can eat. And I didn't realize that I couldn't have 2 bowls of rice instead of, and have a blood sugar in a normal range. So I think it really empowered the patients to take control of their disease process. Getting the doctors involved, because I think there's no better word to a patient than a doctor recommending something. The next best is the nurse to recommend it, and just playing it up of how beneficial it is, and that they're going to take some control, and that we encourage that to all work together as a team to get the success and the benefit of what we want. And the goal of better controlled diabetes is a team effort. It's not just the patient, it's not just the doctor, it's not just the medications, it's everything combined of a team effort. And I think the biggest thing for us getting people here was to have it at the office, because people are comfortable here, they're not going to a strange place. They were, excited to tell us things about the class after the class ended for the day. And it just worked having it here. If there were any questions, we were available to help with the instructors or with the patients. Well, I don't see why anybody should have any misgivings. I mean, everybody needs help. Everybody needs education. It's a service that's free to the patients. They come in and they learn and they benefit from it, and it empowers them. And what better way than to have everybody as a team help control? I don't know why anybody would be opposed to having somebody come and help educate their patients. just would not make any sense.
Classes are taught by 2 trained leaders using the Stanford University Diabetes Self-Management Program curriculum. We host these classes throughout your community once a week for 6 consecutive weeks. They are 2.5 hours each, which includes a 20-minute break. Participating in classes uses no billable Medicare dollars and complements the care you are receiving from your healthcare providers. Please use the contact information on this slide to learn more about these interactive classes. We welcome the opportunity to answer your questions and schedule classes in your facility and community. Looking forward to talking with you soon.